At this time, I'd like to yield, for whatever time he needs to consume, the author of this bill, a member of the Ways and Means Committee, Mr. Roskam. For purposes of describing this bill, I yield whatever time he may consume to Mr. Roskam.
The gentleman from Illinois is recognized for whatever time he needs within the 20 minutes of Mr. Ryan's side.
Thank you, Mr. Speaker, and thank you, Chairman Ryan. I'm pleased to see that we're taking up this 2-year extension of the Independence at Home demonstration project, which expired on May 1st. I first got interested in this because of a constituent, Dr. Thomas Cornwell from Wheaton, Illinois. He's actually a visionary. He was way ahead of his time on this effort to reach out to patients at home. He's the president of the American Academy of Home Care Physicians and chairman and chief medical officer of the Home Centered Care Institute. And he's been really passionate about this idea of trying to reach people where they are. And since his founding of his home care practice in 1997, Mr. Speaker, he has personally made over 30,000 house calls. So he knows intimately the difference that a home care option makes in the lives of individuals with multiple chronic conditions and the savings that it can bring to the healthcare system to treat these people at home rather than at the hospital. So what he's been able to do is to say, look, this is better for the patient and it's better for the system, so let's pursue this and let's move it further along. And that's exactly what the Independence at Home demonstration brings to Medicare. It focuses on reducing costs where the needs are the highest and improving care where the needs are the greatest. It provides home care based to Medicare enrollees with 2 or more chronic conditions who are within 25%, 5 to 25% of beneficiaries that account for nearly 80% of all Medicare spending. Of the 34 Medicare home demonstrations over the past 20 years, the IAH is decidedly different, requiring that doctors meet fiscally responsible conditions of participation. Here's what they've got to do. They've got to return a minimum savings of at least 5% to Medicare. They've got to produce good outcomes. And they've got to pass patient and caregiver satisfaction ratings. It even provides an additional incentive by allowing successful participants to share in any savings that generate for Medicare above that 5% mark on an 80-20 basis. So think about that. Everybody comes out ahead on this, and it's working. In June, CMS reported that IAH saved over $25 million in its first performance year. And that's an average of over $3,000 for each of the 8,400 beneficiaries that participated in the demonstration. In other words, have you heard, have you talked about, have you contemplated anything that's like this? In other words, you've got happier patients, and they're saving money at $3,000 a person. What's not to love about this? We have several lessons that, from this that have been artfully crafted into the demonstration itself. It requires participants to save taxpayer money by avoiding unnecessary hospitalizations, ER visits, and nursing home admissions. It protects the viability of the Medicare program. It provides quality health care for those most in need. And it benefits providers by giving them the flexibility they need to care for their patients and share for the savings they produce. For those reasons, I strongly support passage of this. I thank Chairman Ryan for his support, and I yield back the balance of my time.